Welcome to my review of 2014-15. During my first year as Chief Executive at this Trust, I have been continually impressed by our dedicated, caring and compassionate staff who work across all of our services at all levels, in all roles and in all specialties and services. I've had the opportunity to meet and spend time with many of our staff and teams across the Trust during my weekly frontline visits, covering both day and night shifts. 2014-15 was a really busy year for the Trust. In my first year here, I wanted to focus on instilling pride back into the Trust and starting our journey of change. Hence the title and theme of this year's annual report, Pride in Pennine, A Year of Change. One of my first priorities was to listen and engage with our staff and our partners to develop a strategic vision for the Trust, a clear statement of where we as a provider of high quality healthcare want to be in 5 years' time. This vision is supported by a simple graphical representation which we call our transformation map and which sets out how we will get there underpinned by our new Trust values. To develop our vision, we used a combination of innovative online workshops and focus groups which meant that every member of staff had the opportunity to have their say and to contribute. In a few short weeks, we received over 27,000 contributions from our staff, which helped us define our vision to be a leading provider of joined-up healthcare that will support every person who needs our services, whether in or out of hospital, and to achieve their fullest health potential. This process of having a Trust-wide conversation also helped our staff come together to agree what our new values should be. Through lots of comments, ideas and online discussions, our staff agreed that our values are to be quality-driven, responsible and compassionate. Most recently, we've received thousands of views and contributions from staff to help develop our Happy, Healthy, Here programme. I'm delighted that our Pride in Pennine staff engagement work has also been shortlisted for this year's Health Service Journal Awards, recognising the scale and progress we are making in engaging with our staff in a genuine effort to improve things both for them and in turn for our patients. Over the next 12 months, I will continue to use this method to address a number of other issues which staff have identified as being important through a series of other Pride in Pennine Chief Executives challenges. The next challenge, starting next month in October, will focus on how we can become a truly quality-focused organisation.
Healthy, Happy Here is a transformation programme aimed to improve staff morale, keep staff working at Pennine and encourage more staff to come and work for Pennine.
At the back end of last year, myself and the rest of the physiotherapy team became aware of a fitness movement in Bury called I Will If You Will, which is aimed at getting more women more active more often. And we as a physiotherapy department obviously appreciate the benefits of an active workforce and keeping our patients active, but we wanted to look at a way to spread this a little bit further, both with our patients and our staff. We've collaborated on a number of different activities and events. For example, in June this year, we ran a Workout Work Day event which we put on for all our staff and council staff, and we invited lots of different staff across the Trust to come along and try out some taste of fitness sessions, and we also gave them lots of advice about the benefits of keeping active in work.
Hello, my name's Barry Waterhouse and I'm Travel and Access Manager for the Trust, and this is Westwood Park, our new 562 space staff parking facility that's got centre CCTV, help points, intercoms, direct link to security, secure fencing, and was built as part of our parking plans following comments, suggestions and concerns raised by staff and local residents.
Over the summer of 2014, I, along with the Board of Directors, reviewed and redefined the portfolios of our Executive Directors, reviewed and realigned the governance and board subcommittee structures, and changed the leadership arrangements in our operational management structure. Each division is now led by a triumvirate leadership team comprising a divisional director, divisional medical director and divisional nurse director, who are jointly accountable for the performance and quality standards of the services provided within their division. This new arrangement has placed clinical leadership at the heart of our management structure. Towards the end of the year, we agreed similar arrangements for the directorate level structures. The rollout of this structure at directorate level started in May 2015. In addition to establishing a safety programme to focus attention on key quality and safety issues, as part of our new management arrangements, we have also appointed to 2 new senior posts focused on quality, a Director of Clinical Governance and a Deputy Chief Nurse, and have agreed the establishment of new roles of Director of Midwifery and Deputy Director of Midwifery to bring increased focus on quality and safety across our maternity services. During my first few weeks, I also implemented new arrangements to ensure that the whole senior management team was aware of any serious untoward incidents. This led to the identification of a number of incidents in our maternity service, as a result of which an independent external review of a number of cases was commissioned. The external review report was received in early 2015 and identified a number of areas for action. An improvement plan has been prepared and this is being implemented, led by our Chief Nurse and Medical Director. Our mortality continues to be the second lowest in the northwest of England, with a level of performance which means that statistically 20% fewer patients than expected died in our hospitals in 2014-15. We have continued to deliver against the 18-week referral to treatment target for patients requiring operations and also the cancer targets. Staff who work across our 3 A&E departments in Oldham, Bury and North Manchester and our urgent care centre at Rochdale Infirmary continue to work extremely hard with great commitment and professionalism, often under severe pressures. In total, our A&Es and urgent care services see over 1/3 patients per year. Like many trusts across the country, we experienced a very difficult and challenging winter period with high levels of A&E attendances and admissions and a longer length of stay as patients were more acute at all our hospitals. However, North Manchester General Hospital A&E department, which sees around 100,000 patients a year, performed very well and during the year was the only hospital in Greater Manchester and only a small number of trusts nationally to meet the 4-hour national access standard. We established a Lloyd's pharmacy-led clinic at North Manchester as a pilot this year and have also introduced a new innovative medical staffing model forming 2 hybrid medical teams and integrating local GPs to the medical team in A&E. In August 2014, we appointed a new consultant post in paediatric public health, enabling some groundbreaking research at the interface of paediatric primary care and secondary care.
Instead of trying to continually recruit from a dwindling pool of middle grade doctors, we've been quite innovative and we developed a hybrid model whereby our middle grade tier is supplied by a number of doctors and a number of advanced nurse practitioners. We've got 1 advanced nurse practitioner working in paediatrics and 1 in adults, and they've been absolutely key to the ongoing viability of the service.
During 2014, we introduced a set of widely shared nursing metrics across our medical and surgical wards. These indicators cover those areas which are deemed the highest concern in terms of patient risk and can be used to assure the quality of our nursing at ward level. Metrics are captured electronically, enable doctors and nursing staff on our wards to have access to real-time data and compare results across all our wards by hospital site and by division.
The nursing metrics were introduced following a successful pilot at the Fairfield General Hospital site in July 2014, so we've been undertaking them for just over 12 months now. They're undertaken by senior nurses within the organisation and it's real live measurement of 12 nursing care indicators. Some of those indicators are actually linked to the Trust Safety Programme. For example, measurement of pressure ulcers. We set the standard that all wards would adhere to and measure against those standards, and then we would match those to some of the sequence targets that we also have within the organisation. Originally they were introduced for general medical and surgical wards, and we've actually developed them further than that subsequently to include outpatient departments and critical care areas. All of the 12 measures are actually scored for red, amber or green, and since the introduction we've actually seen some areas that started with red measurements move to amber and towards green, and some wards are now achieving green month on month, and this would be an indicator of good quality care.
During the year, we have also continued to invest and develop services and facilities across our hospitals that will improve patient care and patient experience. These include investment in making some of our wards and clinical areas more suitable to meet the demands of patients with dementia. Since our new Oasis unit at Rochdale Infirmary opened in April 2014, hundreds of patients and their loved ones have benefited from a dementia-friendly environment, enhanced nurse staffing ratios and the specialist input of registered mental health nurses. Through partnership working between local health and social care organisations in Rochdale, this dedicated facility offers patients additional specialist support in an environment that is tailored for their needs and the needs of their families and carers. This is a superb facility with truly exceptional and compassionate staff.
The Oasis unit has been open for 12 months. Celebrated its first birthday in May 2015. It's a 5-bed bespoke designed unit to care for patients who've got a medical problem but who are also living with dementia. During the last 6 months we've had some money invested into us with the purchase of some reminiscence pods, which are a pop-up backdrop that support reminiscence therapy for the patient group that are within the Oasis, the patients living with dementia.
2 major capital building works have been completed at 2 of our emergency departments this year, at the Royal Oldham Hospital and at Fairfield General Hospital. We have also opened a brand new state-of-the-art hybrid theatre following £5 million investment, which confirms our commitment to the Royal Oldham Hospital remaining a major centre for vascular services in Greater Manchester.
We're standing in the new paediatric resuscitation room, which is part of our new development. This has been a £4.5 million development of the department to enlarge it to cope with our nearly 100,000 patients a year that we see here. In the development, the particular highlight has been opening a brand new audiovisually separated paediatric area. That area means that the care that we provide children is now in an environment which is appropriate for their needs. Not only though have we added this area for children, but we've also expanded the facilities for all the other patients. We've got cubicles for more minor patients and more major patients, and now a 7-bedded resuscitation area where we can look after the critically ill patients at the time that they need in the right environment, and it's been a great improvement for the department.
We are now in what is called a hybrid operating room. This is an absolutely state-of-the-art operating room which combines the ability to do both open procedures as well as endovascular, that is keyhole procedures using wires and catheters under X-ray guidance. What makes this unique is that what used to be done with mobile C-arm machinery, which had to be wheeled in and wheeled out, and gave a bigger dose of radiation, is that with this machine we get absolute state-of-the-art imaging. The vessels are shown up much more clearer. We can actually fuse imaging that was taken pre-operatively, that is if the patient had had a CT scan, we can actually bring that to the table here to the screens behind, fuse the imaging that's taken on the table, and that gives us an absolutely accurate picture of how we can put our wires and catheters in. It helps with 2 things. It improves patient safety, it makes the procedure less invasive for the patient, and it improves the amount or decreases the amount of radiation that patients and staff get. When you need to do a combined procedure, that is, part of the operation has to be open with a surgeon and part of the operation has to be done with radiology and x-rays, that is possible in one sitting in this hybrid operating room.
We have continued to place a major focus on patient pathways and improving our relationships and communications with our colleagues in primary care, including our local GPs. Over the past 18 months, the implementation of our electronic prescribing administration system and an e-discharge solution have improved the quality of information our local GPs receive.
And the rollout with electronic prescribing is now taken us to 97 wards live, trust-wide. So another achievement of the EPR team has got to be the implementation of the Evolve system, which is the electronic case notes. As of February this year, we started to introduce the system into 8 patient areas, and by October, the end of October, we should be live in all specialities. The handover of care communication, historically known as the discharge summary. Basically, the team have had to revisit all clinical users and clinicians. We've had to retrain them in the functionality of the system, and we have completely changed the way in which they work. Last year, for example, the Trust was only hitting compliance of 35 to 40% of discharge letters created within 24 hours. Now we are hitting 95%, which is a huge patient safety benefit, and quite simply means that patients and GPs are now informed of the patient's hospital stay and what treatment and interventions they've had.
We have also undertaken significant work on strengthening our partnerships. A key element of providing a quality service is making sure that patients move swiftly through a single joined-up pathway. We must ensure that where patients transfer from service to service or between providers, that their care remains uninterrupted and seamless. Like most NHS trusts across the country, it is clear that as a trust we need to transform the way in which we provide services in order to become clinically and financially sustainable. Our staff recognise and support this and are keen that we quickly develop new models of care so that we can provide even better services for our patients. This need for change is also set against the backdrop of Healthier Together, which is seeking to reshape a number of hospital services across Greater Manchester. As part of the Healthier Together plans to drive up quality and standards in hospitals across Greater Manchester, our site at Oldham has been designated a specialist site and will work in partnership with our other 3 sites at Rochdale Infirmary, Fairfield and North Manchester to combine into a single service for emergency medicine and specialist abdominal surgery. Also is the exciting but still emerging implications and opportunities of health and social care devolution across Greater Manchester, commonly referred to as GM-Devo. This is an exciting and genuine opportunity for the NHS across the region and local authorities to further bring services together to enhance and improve the health and outcomes for the people of Greater Manchester. Fundamental to our transformation journey has been the establishment of a new integrated and community care division, which brings a focus to this area and will build on the successful integrated secondary and community care arrangements which the Trust has managed in North Manchester for a number of years. In November 2014, intermediate care was enhanced for patients in the North Manchester area following collaborative working between the Trust and our local commissioner, North Manchester CCG. We have the exciting opportunity in 2015-16 to further strengthen our integrated and community services as the Trust has taken managerial responsibility for the adult social care service in North Manchester.
We're the early implementer for the City of Manchester, so the first set of services to go live with integrated health and social care, in particular our intermediate care services and reablement and assessment services from the council. So this is all part of a bigger programme called Living Longer, Living Better, about moving a shift of acute care into community services. We've been doing a lot of work around integrating documentation, getting staff to work together, looking at how we triage appropriately for health and social care, bringing pathways together and looking at competencies as well.
We're already in the process of merging and working with the social services and the cancer services really, which means we're integrating a lot more with social services jointly, and also in the future we're hoping to have a new build which will allow us to have more beds available to work quite closely with patients again within the community setting.
Without the skill and dedication of our staff, we would not be able to provide the highest quality healthcare to our patients and their families. Every week I receive many letters and emails from patients and their families asking me to pass on their thanks and praise to our staff for their skill, compassion and care. These compliments, along with other staff achievements, are routinely shared across the organisation through my weekly Chief Executive message to staff. Over the past year, many of our staff have been recognised for their professionalism, skill and innovation locally in our annual staff awards, and some have been recognised nationally in a variety of health sector awards.
The Trust's impressive research performance has been recognised nationally and regionally. Nationally, we were shortlisted as a finalist at the HSJ Awards for demonstrating a clinical research impact. And regionally, we were recognised at the Greater Manchester Research Awards, where we won Investigator of the Year Award, we won Lifetime Achievement Award, and we were runner-up in the Team of the Year Award.
The NHS continues to operate in challenging financial times. The next few years will continue to present further financial challenges nationally, and our Trust must do its part in addressing its underlying deficit while also ensuring that the increasing demands placed on us to further improve quality are delivered. I'd like to take this opportunity to thank all of our staff, our volunteers and partners who have worked with us throughout the last year and who continue to work with us in transforming our services as we continue to instil pride into Pennine. Thank you.